Good afternoon, students. This is Dr. Green. I'll be giving you a integrity presentation for week 11, and it is concerned with chapter 9, and we'll be discussing populations and samples in research. All right, so this is week 11, chapter 9, examining populations and samples in research. These are the learning objectives. There are 2 pages. Describe sampling theory, including important concepts: population, target population, sampling criteria, sampling frame, subject or participant, sampling plan, sample representativeness, sampling error, and systematic bias. And as usual with each chapter, we talk about critically appraising a particular study or particular aspect of a study. So in this chapter, we're talking about appraising the sampling criteria in published studies. And then identify the specific types of probability and non-probability sampling methods used in quantitative, qualitative, and outcome research studies. Describe the elements of power analysis used to determine sample size in selected studies. Critically appraise the sample size of quantitative and qualitative studies. Critically appraise the settings used in quantitative, qualitative, and outcome studies. So let's begin with what is a sample. And since you've had statistics, I'm pretty sure you're familiar with the term sample. So a sample is a subset of the population that's selected for a study, right? We can't study everybody, right? So we pick a portion of the population of interest. So the sample defines the selected group of people or elements from which data are collected for a study. The concepts related to sampling include selecting a group of people or events, behaviors, or other elements with which to conduct a study. And a sampling plan is simply a method that outlines the selection process, how you're going to sample to obtain a selected portion of the population. Members of the sample can be called both subjects or participants, and I've noticed lately the word participant is favored more than subjects. What are the components of a population? A population is a particular group of individuals or elements who are the focus of the research. So these are important terms for you to note. What is a target population? This is an entire set of individuals or elements who meet the sampling criteria, right? So I remember from my statistics course, the professor said a peanut farmer, right, in Georgia, and the peanut farmers in a particular county in Georgia would be one defined population. And if we go to 1 or 2 or 3 farms, that would be a sample. An accessible population is the portion of the target population to which the researcher has reasonable access. And elements are individual units of the population in the sample. What are the components of a population? The components of a population include the target population, the accessible population, and the elements. So here is a very nice diagram that shows you at the center here, the center, the subject or the participant. That's an element. And then the sample is a larger group of persons or elements. That would be the light blue. The accessible population is the population that's available to the researcher. And the target population is determined by the sampling criteria. So the accessible population is smaller than the target population. This is a term that you may or may not be familiar with, generalization. This is the process of extending findings from the sample under study to the larger population. Generalization is made from the sample to the population from which it was drawn. And we're talking about the findings of the study. Generalization refers to the extent of generalizability, which is influenced by the quality of the study and the consistency of the study's findings. Here is a question for you. Sampling in research may be defined as A. Ensurance that each person has a chance of being included in the study. Establishment of criteria for eligibility to participate in the study. Identification of the population in which the researcher is interested. Selection of a subset of a population to represent the whole population. So D would be the correct answer. What are exclusion criteria? Exclusion criteria are characteristics that can cause a person or an element to be excluded from the target population. For example, the participants must not be less than 18 years of age, must not be unable to speak or read English. They must have not have a diagnosis of cognitive dysfunction or diagnosis of mental illness. I skipped over this one. What are inclusion criteria? Inclusion criteria are characteristics that the subject or the element has to possess to be part of the target population. So examples would be subjects or participants must be between the ages of 18 and 45, ability to speak English. If you're doing a study on patients with gallbladder, they have to be admitted for gallbladder surgery. Or if you're doing a study on diabetes, they would have to be diagnosed with diabetes within the past month, if that's your interest area. Exclusion criteria are those characteristics that can cause someone to be excluded from the population. This is a very nice flow chart that talks about a study called the effects of intensive glycemic controls on outcomes of cardiac surgery. So here is we're focusing on the enrollment here. They determined that there were 298 people eligible for the study. 86, an N of 86 participants were excluded because they didn't meet the inclusion criteria or declined to participate or other reasons. So 212 were randomized to one or the other group. The usual care group is the control group, and the intervention group is the therapy group. So under the usual care group, they had 107. They received the usual care, and No one was lost to follow-up or discontinued the usual care. So they had 107 cases to analyze. That was in the usual care, the control group. In the intervention group, the therapy group, they had 105. So you see there's a slight difference in the number, the N, but it's not very large. They received the intervention, 105. No one was lost to follow-up or discontinued the intervention, and they had 105 cases to analyze. Okay. What are two ways to define sampling criteria? They use the words homogeneous sample or heterogeneous sample. So sample, homogeneous sample. The samples are as similar as possible so as to control for extraneous variables. And this decreases the ability to generalize widely and provides poor external validity. So the other term that you'd want to know is heterogeneous sample. They're dissimilar. This represents a broad range of values. It provides better external validity, but internal validity may be affected by extraneous variables, used when a narrow focus is not desirable. So I just want to go back one slide. Okay, we have 298 participants eligible, and we had the two groups, the control group and the intervention group. We want the members of this group and the members of this group to be as similar as possible. Okay, we don't want them to all be good cases over here and all be bad cases over here, right? So if they are as similar as possible, it helps to control for extraneous variables, but to some degree it decreases the ability to generalize. What are inappropriate generalizations? Samples cannot be generalized beyond their sampling criteria. And if you do generalize beyond the sampling criteria, you're making an inappropriate generalization. Sampling error. Sampling error is a term that means the difference between the population mean and the mean of the sample. Within any sample, there are differences. So let's say you're measuring the height of 10-year-olds in the 4th grade, right? One student will have a different height from another, right? So, and this happens as you go from child to child to child to child. The expected difference in values that occurs when different subjects from the same sample are examined or measured. Right? It's random. The difference is random because some values will be higher and others lower than the average population values. What is sampling error? So this diagram has two parabolas here, right? This structure is, this structure here is talking about, if we're talking about scores, they're talking about average scores. So right here in the middle would be the exact average score. Some will be a little lower on this side, some will be a little larger. And if we go beyond these boundaries, right, we start getting differences farther away from the average or the mean. So the farther we go to the left or the farther we go to the right, we're getting different values. What types of sampling errors can occur? So we can get error in sampling by bias or systematic variation. And this is the consequence of selecting subjects whose measurement values differ in some way from those of the population. The values do not vary randomly around the population mean. So selecting subjects who in general have higher scores than the mean, or selecting subjects who have lower values, quite a lot lower values than the mean from those of the population. Subjects who participate in a study of patients with inflammatory bowel disease are described as the A, accessible population, element, sample, or target population. Okay, the answer would be sample. Representativeness. The sample, accessible population, and target populations are alike in as many ways as possible. The sample must be representative in terms of a whole host of characteristics, right? So the sample, if let's say we're looking at a study of memory capability in the elderly, right? You would specify that you want the age range, let's say, to be between 65 and 85. So if you have a sample that has a lot of people in their lower 50s or 40s, right, it'll be hard to generalize to the a larger population. You're skewing your sample with too young people when you really want to focus on 65 to 75-year-olds. And the same thing for gender, ethnicity, income, education, right? Your sample, you don't want to have a wide variation in educational level. What is the difference between random and systematic variations? Well, first we'll define variance. I know you studied this in statistics, that variance is the measure of dispersion in which the larger the variance, the larger the dispersion of scores. So when we saw that diagram with the two parabolas, and the farther you went to the left, the farther away you were getting from the mean. The farther away you went to the right, the farther away the scores were getting from the mean. Larger samples are more representative than smaller ones because they contain less random variation. So, what is random variation? This is the expected difference in values that occurs when different subjects from the same sample are examined. Now, systematic variation, or systematic bias, this is something that you don't want in a study, because this is a problem, and this problem is the consequence of selecting subjects whose measurement values differ in some way from those of the population. What is the difference between the refusal rate and the acceptance rate? The refusal rate is the percentage of subjects who decline to participate in the study. So if you had 80 subjects approach and 4 refused, 4 divided by 80 is 5%. So as the number of persons refusing to be in the study increases, the possibility of systematic bias increases. It's like, if so many are refusing, who is left, right? People who are left may differ quite a bit from the people who decided to leave. The acceptance rate is the percent of subjects who consented to be in the study. So if we had 80 subjects approached and 76 accepted, 76 divided by 80 is 0.95 or 95% acceptance rate. Systematic variation or biases decrease with high acceptance rate or a low refusal rate. Sample attrition and retention. Sample attrition refers to those subjects who drop out of a study after having begun the process. So the withdrawal or loss of subjects from a study. The attrition rate is equal to the number of subjects withdrawing divided by the number of subjects, study subjects, times 100. And sample retention is the number of subjects who remain in and complete a study. Random sampling. So what is random sampling? This is a technique in which every member or element of the population has a probability higher than 0 for being selected for a sample. Random sampling increases the representativeness of the sample based on the target population. Random sampling can be achieved by placing the names of people who have agreed to be in the study, placing their names in a hat, and then picking out random slips of paper from a hat, or table of random numbers. See table 9-2 in your textbook for a table of random numbers. The control group is used in studies with random sampling. A comparison group is not randomly determined. Interesting point. How would you describe a sampling frame and a sampling plan? So they're two different things. Sampling frame is merely a listing of every member of the population using the sampling criteria to define membership. Subjects are selected from the sampling frame. The sampling method or the sampling plan is a strategy that's used to obtain a sample. So would it be a probability sampling plan? That would require random sampling, and a non-probability sampling plan would be non-random sampling. The types of probability sampling. There's simple random sampling and stratified random sampling. Simple random sampling is random selection of elements from the sampling frame for inclusion in a study. Stratified random sampling is a sample that is divided into strata or groups using identifiable variables. So let's say you have a study where you're looking at an educational approach to diabetic teaching, right? We've talked about this before, where you would have groups, maybe 3 different groups. One group receives a group class teaching. The second group receives a pamphlet only. The third group receives an audio-visual only. Those would be 3 groups or 3 strata, and those would be your independent variables. What are the types of probability sampling? Okay, so here we had simple random, stratified random, and now we have 2 more: cluster sampling and systematic sampling. Cluster sampling is a randomized sample that's drawn from the list from the sampling frame. Systematic sampling is selecting every kth individual from an ordered list of all members of the population using a randomly selected starting point. So we have this list of all members of the population, and we decide to pick every 10th name on that list, or every 100th name on that list. And the starting point would be just randomly selected. How is sample size in quantitative studies determined? Well, we have to talk about effect size, and we'll talk about that some more in a minute, but effect size helps determine the sample size. The degree to which the phenomenon studied is present in the population, or to which the null hypothesis is false. The type of quantitative studies conducted, the number of variables in the study, the sensitivity of the measurement tool, and the appropriateness of the data analysis techniques. What is power analysis? First, we'll talk about power. So power refers to the ability of a study to detect differences or relationships that actually exist in the population. The technique is used to determine the risk of a type 2 error, so the study can be modified to decrease the risk if necessary and ensure the study has an adequate sample size. It's the ability to detect differences in the population or the capacity to correctly reject a null hypothesis. The minimum acceptable level of power is 0.8 at either the 0.05, 0.01, or 0.001 level of significance. Now, effect size. Back to effect size. So an effect is the presence of the phenomenon being studied. It's the percentage of change in a variable or numerical strength of a relationship. The effect size is the extent to which the null hypothesis is false, right? That makes sense. The presence of the phenomenon is present. Tells you whether there is a difference between groups or whether variables are significantly related. It tells you the size of the difference between the groups or the strength of the relationship. So when the effect size, the ES, is large, you have a large difference between groups, only a small sample is needed. But increasing the sample size will increase the effect size. These are the numbers associated with small, medium, and large effect size. So less than 0.3 or greater than minus 0.3 is a small effect size. A medium effect size is 0.3 to 0.5 or minus 0.3 to minus 0.5. And a large effect size would be an effect size greater than 0.5 or less than minus 0.50. How do you determine the number of variables? As the number of variables increases, the sample size needed may increase. The inclusion of multiple dependent variables also increases the sample size needed. What is measurement sensitivity? So when measurement sensitivity is when we're using a tool, right? Say, a tool to measure neurologic status. Okay, was the tool used a reliable and valid measure of the variable? Or is the tool less well developed? So is the tool in the study, was the tool a well-known, well-documented, valid, reliable tool and the measurements were given? Or is this tool less well developed? Is it a new tool? Right? So as variance in the instrument scores increases, the sample size needed to obtain significance increases. What statistical techniques can be used for data analysis? You are probably familiar with ANOVA and the t-test. These require equal group sizes, which will increase power because the effect size is maximized. Now, chi-square is considered the weakest of the tests and requires a large sample size to achieve acceptable levels of power. As the number of categories increases, the sample size must increase as well. I think you're starting to see a pattern here, right? What is involved in critically appraising a study sample? To critically appraise a study sample, you must identify the elements, the accessible population, and the target population, and then evaluate the appropriateness of the generalization that's made by the researcher in a quantitative study. The population from which the researcher selects the actual study sample is referred to as accessible population, scientific population, target population, theoretical population. Okay, so think about that. Try to figure out the answer. Appraising the sample. You must identify the sample criteria that the researcher used. You have to judge the appropriateness of the sampling criteria and identify the sampling method that was used. So we have all been, recently we've been talking about probability sampling. Okay, now we're going to talk about non-probability sampling. This is used in qualitative research. They use purposive sampling, network or snowball sampling, and theoretical sampling. We'll go through each of these. What is purposive sampling? Purposive sampling is selective sampling. So in a qualitative study, they use this selective sampling. It involves a conscious selection of certain participants or elements to include in the study. So if someone is interested in the day-to-day life of someone with multiple sclerosis, right, they consciously select individuals who have a diagnosis of multiple sclerosis. There's no randomness, right? It's also called, purposive sampling is called judgmental sampling, selective sampling, or purposeful sampling. Efforts are made to include typical or even atypical subjects. And the sampling is based on the researcher's judgment and is often used in qualitative research. What is network sampling? Network sampling takes advantage of social networks out there in the community to get the sample. So one person in the sample asks another to join the sample, and so on. It's also called snowball sampling. Another type of sampling in qualitative research is called theoretical sampling, and this is used in grounded theory research. The data are gathered from any individual or group that can provide relevant data for theory generation. The sample is saturated when the data collection is complete based on the researcher's expectations. Diversity in the sample is encouraged. So how is sample size determined in qualitative research? Or how does the qualitative researcher know how big a sample to strive for? It depends on these four things: the scope of the study, the nature of the topic, the quality of the information desired and obtained, and the study design. So for scope of study, the sample size will depend on how broad or how narrow the topic the researcher is interested in. It also depends on the nature of the topic. Is the topic difficult or awkward or sensitive one? One that people don't really talk about easily, that may need a larger sample in order to get quality data. The quality of the information. Rich data requires few participants to reach saturation, meaning if you obtain participants who have a lot to say, right, and the data that you're getting is real quality data, you may not need as many participants to reach saturation. And study design. The sample size can be determined by the study design. So if the researcher is doing multiple interviews with persons or families, the multiple interviews, seeing them several times, usually produces more data and more quality data. How is the sample adequacy determined in qualitative studies? If you're reading a study that is a qualitative study and you're trying to critique sample adequacy, ask yourself these questions. From what you have read, are the sampling inclusion and exclusion criteria appropriate? Is the sampling plan adequate to address the purpose of the study? Is the sample size adequate? What are the refusal and mortality rates? Are the sample characteristics and quality described? Is there saturation of the data? Is the setting defined? I want to go back to this saturation of the data. So the qualitative researcher will be conducting interviews, and we talked about how they categorize the data, and then they identify themes, right? And as they interview more, they add to the categories, and from that they deduce themes. And it gets to a point where no new data is being developed or being gathered. That would be the point of saturation. And the researcher then knows my sample is complete. There's an unfolding case study. You are a holistic nurse who is working with an interprofessional team consisting of a physician and psychologist. The team receives IRB approval for a pilot study on an intervention known as heart-assisted therapy. It was created by a team psychologist and is being investigated with the geriatric population as a self-regulation technique to increase physical and psychological well-being. You designed this PICO question prior to approval phase of the study. P, geriatric patients in a residential retirement community. I, intervention, heart-assisted therapy, SR. C, health effects of HAT-SR versus placebo. O, improved health effects for HAT-SR. And T, a 6-week study. I want you to take some time to think about the following. The IRB approved the study as a randomized control study that can admit 60 patients. You will be in charge of seeing study participants. How would you begin the process of selecting the sample? What factors will you need to consider? Who is the target population? What inclusion and exclusion criteria might be factors in a study that involves geriatric patients in a retirement community? How can you prevent sampling errors, and what type of sample would be best to control for extraneous variables? What are the factors to consider when selecting the sample size? How will you calculate the appropriate sample size? What questions would you consider when appraising the sample? right. This concludes the integrity presentation for Chapter 9. Here are their objectives once again. And I have discussed all of these objectives for you. And I suggest that you read the textbook and listen to the integrity presentation and download the PowerPoints for week 11. Thank you.